Hello, everyone, and welcome to today's Arthritis at Home. I'm joined by Dr. Carrie Ye. Carrie is an associate professor in the Department of Medicine at the University of Alberta. Her rheumatology practice is focused on osteoporosis and rheumatic toxicities of cancer immunotherapy. She's also the medical director of the Northern Alberta Osteoporosis Program and the clinical lead of the Canadian Research Group of Rheumatology in Immuno-Oncology, otherwise known as CanRIO. More recently, her research has explored the use of large health data sets and artificial intelligence to improve the identification and management of rheumatic and bone health conditions. Thank you so much for joining us today, Carrie.
Thanks for having me. I'm looking forward to our chat.
Carrie, I know you do so many things, but could you tell us a little bit more about yourself and how you became involved in rheumatology?
Um, oh gosh, I definitely did not go into medical school wanting to be a rheumatologist. I actually wanted to be a heart surgeon. And then I really liked internal medicine and I liked um, the diagnosis part of medicine the most, I would say, maybe more than the therapeutic part. And rheumatology is all about solving mysteries and thinking about complex cases. So I think that's probably what drew me to rheumatology.
That's incredible, Carrie. Would you tell me a little bit more about then how you kind of got to this intersection of rheumatology and oncology?
Okay, so I actually can remember the exact day that I got into it, and it was in 2016. I had just finished my rheumatology training. I was a brand new staff, and I was referred this patient who developed arthritis from, I think it was ipilimumab at the time. And I remember being like, what's ipilimumab? Like, why am I getting this referral? I knew nothing about it. So I quickly did a Google, and it was like I found like 7 case reports in the world about inflammatory arthritis related to this drug. I remember reaching out to a colleague, like someone I trained with, and she was like, "Oh, I actually heard about this at the Harvard Review course for rheumatology this year. I'll send you the slides." And so then I was like, "Oh, wow, like this is a brand new thing. I need to learn about it." And then I think once I started learning about it, the oncologists were like, "Can we keep referring these patients to you?" And I was like, "Sure, I'll, get more experience." And slowly that turned into like a local cohort. And the same thing was happening all across Canada to rheumatologists. So we met at CRA and said, should we like start collecting these cases? So that's kind of how it became like a formal area of interest for me.
Oh, so Carrie, if I'm getting this correct, let me know. The patient that you were referred in that case, they were on oncology medications that caused a rheumatic condition?
Yes. So these immune checkpoint inhibitors, at the time they were new, but now they're considered the standard of care for so many different cancers. They work by activating the immune system. So when it does that, it can cause all sorts of different toxicities, including um, toxicities that look just like our regular rheumatic conditions because they cause inflammation in different organs, particularly the joints. So that's where we get involved as rheumatologists.
That's incredible. The cross collaboration between different specialists. It's just really great to see that and also hear about it. Carrie, then can you tell me about this kind of formalization of, if I'm getting it correct, the CanRIO, the Canadian Research Group of Rheumatology in Immuno-Oncology?
Yeah, so it's a great group of rheumatology colleagues from across Canada who are interested in seeing these patients. So we have what we call RIO or rheum-onc clinics all across Canada, most of the large centers, including some smaller centers as well. And what we try to do is just systematically collect data on these patients who are willing to consent to be part of our registry, so that we can understand these toxicities better and hopefully come up with better ways to predict who gets them and, find solutions or treatments that will actually work at treating them. Because the goal in these patients, not only is it to manage their joint disease, but really it's to help them continue on these drugs that are potentially life-saving, but also causing them severe symptoms. So there's kind of two main goals in the treatment of these patients, which makes them really unique.
Yeah, absolutely. And are you currently recruiting any for any studies with this group? Or are you, looking at specific one of those research questions that you just noted?
Yeah, great question. So our prospective cohort, the national cohort, it's actually, I think, still the largest national cohort in the world. And as long as a patient is being seen at one of these rheum-onc CanRIO sites, they'll be asked if they would like to participate in the cohort. So that's always ongoing. We do have a brand new study that's launching looking at using a biologic agent as induction treatment for immune checkpoint inhibitor associated inflammatory arthritis. It was actually funded by CRA, and everything is in place, Health Canada approvals, ethics approvals, and we're basically ready to start recruiting like this month. So that's a really exciting new study.
Very exciting, Carrie. And for our audience or anybody who, can share this with their own networks, we'll link that just down below in the video. So thank you, Carrie, for sharing that. Now, Carrie, kind of pivoting and touching on some of your work more recently in another area. You know, I came to know of you and build a connection with you because of your interest in artificial intelligence. Can I ask you how you kind of fell into artificial intelligence and how you kind of used it and integrated it within your own work?
Yeah, well, before I start, I should just say I love working with you, Ellen. You're a superstar.
Thank you.
So the way I got into AI, I mean, I think I'm not even sure. I think it's just interesting, and I always like to follow where like research is going. But part of it is that I completed a course-based master's in epidemiology a couple years ago, and I specifically wanted to do a course-based one because I just wanted to take a whole bunch of statistics courses. I mostly my research is in epidemiology, so I deal with big data. And if you do enough statistics courses, you just end up in machine learning courses. Like that's just the natural trajectory of using big data. And so I think that gave me a lot of comfort once I understood major concepts within machine learning to then transfer that those sort of theoretical knowledge to large language models and computer vision, even though I'm certainly no like technical expert in that area. I think just understanding how training, fine-tuning, validation works made me a bit more comfortable with sort of modern AI technology. Um, and then I think a big part of it is I didn't want to get left behind. Like this is the new hot area. There's funding in this area. There's really exciting ways to integrate these tools into clinical care and research. So I wanted to learn more about it so that I didn't get behind, get left behind.
Absolutely, Carrie. And from our work together, I also have this feeling that you, number one, really care about patients, and number two, you want to be able to help inform the design of better AI because, there fair enough, there's a lot of hesitancies with the use of AI, and there continues to be this issue of trust and reliability and even environmental impacts. And using like how do we use AI most effectively, most consciously, right? There's so much work to be done in this area, and I feel like as we do more work, more research questions continue to come to us, right?
Totally, totally. I think you're so right. There is so much good and bad chatter about AI. And I think it's really easy to get scared and say all these things can go wrong, and so we shouldn't do it. But I also think it's like saying there's so many things that can go wrong with the internet, so let's just forget about internet. I feel like it's one of those technologies that's here to stay, and I think we, instead of maybe ignoring it or hoping it goes away, my approach is more like I want to understand more about it and maybe be part of the solution in terms of like finding more positive uses and making sure that the right stakeholders are involved in the development of these tools, particularly in medicine. We, having worked with excellent computer scientists, I think that our role as physicians and content matter experts is really essential in making sure that whatever tools are created really align with what's best for patients, what's best for the healthcare system. And what you touched on the environmental impact is huge. I think that it's something that's definitely not talked about enough, but we're literally just like pumping gas directly into these data warehouses and computer environments. And some of the research we're doing right now is actually seeing if we can balance reliability, accuracy while using the smallest models possible so that we can have a smaller environmental impact while still providing the advantages of large language models. That's part of the chat room project. But yeah, I totally agree. I think there's my approach instead of fear, because I do have fear and hesitancy. My approach to that is like, I want to learn more and I want to be on the other side helping to build it, because I think that actually takes away a lot of the fear.
Absolutely. And for patients to be informed as well and to know that, researchers are absolutely at the forefront. Many are, and many are working to make sure that these models are, like you said, accurate and useful, accessible, but also balancing the environmental impact. In that case, Carrie, what do you see as kind of the biggest opportunity and maybe the biggest challenge specifically for AI use in rheumatology?
Oh gosh, there's so many opportunities for AI to improve patient care. I think that's what's so exciting is I feel like I could generate a list of like 100 projects that I could start working on today, but I don't have time. But I mean, we can improve patient education, we can improve prediction of disease, we can improve identification of disease, we can improve selecting the best patients for certain treatments. Like the list is endless. Um, but then on the flip side, the biggest concern or potential adverse effect of AI is poor model building, poor model understanding, not using the right data, excluding patients, having models that aren't representative of the true population, models that are biased. Like there's so many things that can go wrong. But as is the case with any statistical modeling, as is the case with any study design, is you just have to be really thoughtful that what you're doing really reflects the end goal and reflects the patients that you're trying to help. So I don't think those challenges are necessarily unique to AI. I think it's unique to any sort of evidence generation. Yeah.
Oh, absolutely. And, you know, whether like I would say individuals who are clinicians, who are researchers, even patient advocates, whatever we do, patients are still going to reach out to these models and use them now, right? Because like you said, we can no longer stop it. The ball is rolling. They are only becoming more accurate and more accessible. But how do we ensure that the data that they're trained on is number one, representative of the population, and number two, like what goes on the like the transparency of the model in terms of how it kind of produces the response to patients. Lots of work to do there. So
Totally.
Carrie, thank you so much for your work in like multiple domains of rheumatology. And really, I love that you're finding these niches that are so unique but so relevant to the population and to your patients. And thank you for your work as both a clinician and a researcher.
Thanks, Ellen. It was fun to share a little bit about what I've been working on these days.
Thank you to our audience, and we hope you join us next time for another episode of Arthritis at Home. Bye for now.